Okay, this is the second part of my video. I was up to the tongue. Cranial nerve number hypoglossal nerve. That's a tongue movement. Okay, so the back portion of her tongue, she has full taste and speech, is normal and well understood. When you digest or when you have a bowel movement, does your heart rate slow down?
No.
Okay, so that's normal. Vagal nerve is normal. Tongue, cranial nerve number same one, 12. Normal functioning of her tongue. Okay, so now we'll go on to the neck. Symmetry, lumps, pulsation. Her tongue is symmetrical, no lumps. Okay, normal. Or pulsation. Cervical lymph nodes. Feels normal. Okay. Carotid pulse, roots if indicated. No roots felt. Tracheal, normal and aligned in the middle. Range of motion and muscle strength. Cranial nerve number 11, the spinal accessory nerve. Okay, so what I want you to do is pick up your. Okay, good. Normal, cranial nerve number 11, spinal accessory. Okay, I'm gonna feel for your thyroid gland. Swallow. Okay, just swallow. Thoracic cage configuration. Skin characteristic. Dry and intact. Okay, breathe in. Breathe out. Okay. Chest and lungs are symmetrical. Expansion is good. Symmetrical expansion. Tactile freminess, none seen. Lumps or tenderness, none seen. Spinous processes, normal. Percussion. Percussion over lung fields. Okay, I'm gonna listen to her lungs. Okay. Breathe in and breathe out, okay? Okay, sit up a little. Okay. I'm gonna go from side to side, from left to right. Okay, breathe in, breathe out. Okay, sounds normal. Okay, let's see what else. No abnormal breath sounds, diaphragmatic excursion, able to expand diaphragm with no problems, no labored breathing. CVA tenderness, no tenderness, breath sounds, not labored. You don't have any labored breathing, right? Well, sometimes you do, right? Because of asthma?
I have a chronic asthma.
Right. So sometimes you have labored breathing.
But not right now.
When do you usually have it? Like, what causes it?
Going up and down stairs, running, humid weather, cold weather, hot weather.
And what do you feel? Just like tightening in your chest?
Yeah.
And
constriction.
what inhalers do you take?
Provia.
Okay. And does it help you?
Yes.
After?
It opens up.
Okay. And you feel like less tight?
It takes a little time though.
Okay. All right. So adventitious sounds, none heard on auscultation. She just does have the tightening in her lungs, but I don't hear it when I auscultate on her. Okay, next. Respirations and skin characteristics, chest, lungs, and anterior. Respirations and skin characteristics. 18 respiration rate. Skin is warm, dry, intact. Tactile prominence, lungs tenderness, none noted. Lungs clear, breath sounds not labored. Upper extremity, range of motion and muscle strength. Okay, so go like that. Try to lift as high as you can. This one you could lift higher, right, than this one? Mm-hmm. Okay, so you have limited range of motion.
Right.
Because she had the rotator cuff surgery, so on the right shoulder. Epitracheal nodes, normal. Okay, breast, symmetry, mobility, dimpling. Breasts are symmetrical, mobility, able to move. You don't have pain, right, when you move your breast?
No.
Do you have any dimpling? Okay, because that could be a sign of breast cancer, dimpling and pain. Supraclavicle and infraclavicle areas. Okay, let me just check. Okay, normal, no redness or swelling. Okay, teach breast self-exam. Do you know how to do a breast self-exam?
Mm-hmm.
Okay, what do you do?
Put your hand flat and you go around in circles.
Yes.
Mm-hmm.
And the best place to do it is in the shower.
That's what I do.
Yeah. And yeah, you go in circular motions and check for any redness, swelling, tenderness, anything abnormal that you see, retraction, leaking from the breast, from the nipple. And it's best, since she no longer has her menstrual cycle, it's best to pick a day of the month, you know, your favorite day, anniversary, your birthday. So this way you remember each month to do it. You should do it every month. And if you feel anything abnormal, you should go to your doctor right away to get it checked out. And didn't you have lumps before?
Yes. 5 masses.
I don't know what I meant by. Sorry. Just the way you said it. I'm sorry. Just the way she said it. But you had them removed, right?
Right. 5
And
masses,
they weren't cancerous.
not cancerous. 5 masses out of this breast and 1 mass out of that
Thankfully,
breast.
knock on wood, they weren't cancerous. But did you do self-exam? Is that how you knew?
Yeah, I found them. I found all the
See?
masses myself.
And it could have possibly turned into cancer.
Mm-hmm.
So it really does work, the self-exams. I believe in them. Okay. Anyway, let me continue. So you know to report it to your doctor if you feel anything, because you have before. Neck vessels, jugular venous pressure, normal. Jugular pressure if indicated, no. Precordium pulsations and heave, none seen. Apical pulse. Check the apical pulse. Okay, it was about 81, her apical pulse. Precordium thrills, no thrills noted. Apical rate and rhythm, like I said, 81, normal. Heart sounds normal. Okay, contour symmetry of abdomen. Okay, just have to check abdomen. Okay, smooth and symmetrical. Skin characteristic, warm and intact, no redness, bumps or bruises. Umbilicus and pulsations, normal. Bowel sounds, and check for the bowel sounds. Okay, bowel sounds heard in all 4 quadrants. Fascicle sounds normal, percussion. Okay. River span and rate, MCL, liver. Okay. Palpating. I do feel it. Okay. Light and deep palpitations, palpation of liver, spleen, kidneys, aorta. Palpated and liver feels a little enlarged. She does have a fatty liver. Abdominal reflexes, normal. Femoral, femoral pulse. Okay. Felt normal. Ingredient nodes felt normal. Lower extremities symmetrical, yes, is maintained. Skin characteristics, hair distribution, she doesn't have any hair. on her legs because she shaves. Pulsus popliteal, posterior tibial. Okay, felt the pulse. And on her feet and her tibia. Temperature pre-tibial edema, warm and intact. Toes, good circulation. Capillary refill should be less than 3. Range of motion, muscle strength in hips. Range of motion is well established in hips. Knees is well established. Ankles, feet is able to be made. Neurological. Sensation, face. Do you have full sensation in your face?
Mm-hmm.
Arms and hands?
Mm-hmm.
Full, complete sensation. Legs and feet?
Yes.
Position sense. Able to maintain position sense. Able to maintain position sense. Cerebral function, finger to nose. Cerebral function, heel to shin. Okay, able to follow. Deep tendon reflexes. Biceps. Triceps. Just gonna hit. Supposed to use the tool, but I don't have it. +2, triceps 2, +2. Brachiodialysis on her leg and patella 2+. Achilles shin also 2+. To his normal DTRs. Babinski on her feet. Normal reflex. Okay, so now you have to stand up. We're gonna check. Walk across the room. Just walk from here to here so that she could see. Heel to toe. Okay, able to do without any issues. Walk on tiptoes and walk on heels.
Mm-hmm.
Okay. Romberg sign is normal. Shallow knee bends. Do a knee bend. Touch toes. Stand up and touch your toes. Range of motion of spine is good. Okay. So that was everything for you. Thank you, Mom.
All done?
Yeah, all done. Now we gotta just do the male part of it. I gotta say what I inspected.
Who you inspecting? Who?
Tony. I already did it. I can't stop laughing. I'm sorry. I'm like a cornball. Okay. So now, I'm gonna just report what I found. Cause I couldn't film it, but penis and scrotum, no lesion seen or swelling. Testes and spermatic cord, no tenderness or swelling in areas. Inguinal hernia, none. Teach testicular self-exam. Make sure they do it in the shower once a month, or or more frequent to test for any lumps or unusual swelling, tenderness. Male rectum, perianal areas normal. Rectal walls and prostate gland normal. Stool for occult blood, no blood found in stools. Female genitalia and rectum, perineal and perianal look normal, no redness or swelling. Vaginal speculum, cervix and vaginal walls looks normal. Procu specimens, bimanual cervix, uterus and axilla looks normal. Rectal vaginal and stool for occult blood, no blood seen in stool. And help the patient up. Thank you for your patient's time and depart from patient. Thank you so much. It's been a great semester. I really learned a lot.